Hello and welcome to our first Wellbeing Training Academy podcast. My name's Andrew Farquharson.
My name's Abby Twomlow.
And we are the directors of the Wellbeing Training Academy. We both have backgrounds in education and applied positive psychology. We work with businesses and in the education sector.
We've worked together for many years. We've been friends for a long time, running separate businesses, but we've always supported and helped each other. And we decided it was finally time to collaborate to build the Wellbeing Training Academy, because two heads are better than one. And between us, we have a lot of experience and a lot of skills to offer.
That's right. And so today's podcast, the first of many, is about the effect of mental well-being on other people, particularly sort of staff members, whether that's in business or in an education setting. I don't know if you're aware that the statistics show that about 84% of all employees are affected by some form of either physical or mental well-being problem when they're at school or in business. And this obviously will have an effect on how they perform. And for instance, in a business, this will also affect the productivity of the business.
Well, one of the stats that I find really interesting is that mental health makes up for 54% of all sick leave. So it's over half of people that are off sick. It's due to mental health. Now, that might not always be what you think. It might be something really clear cut, like stress or burnout or, anxiety and depression are big issues these days. But it might also be things like stomach issues, IBS, irritable bowel syndromes, migraines, even coughs and colds can be down to mental health, because if you are at high stress a lot of the time, it actually represses your immune system. So you're much more prone to get these bugs and illnesses that go around as well. So I actually think probably the statistics should be slightly higher than that. But yeah, we certainly know for sure that mental health equates to a lot of your staff being off sick, and also turnover as well. There's a lot of staff. I think it's about 20% of staff who cite mental health as a reason for leaving their job. So the impact just on your business or school in those simple statistics is quite clear cut. But actually, what about the people that are still working there? What about the people who you may not realise have got an issue? Because I think quite often people don't know what they're looking for, and that includes management and leadership teams and key stage leaders and line managers. How much mental health training is there to pick up on these things, or is it only that we recognise when people are in crisis?
I think the answer to that question at the end there, Abby, is we only tend to recognise things when they're in crisis. And the difference between physical health and mental health is, one, that mental health in the past has been looked upon as with a bit of a stigma. So people aren't willing to share it. It's also not as obvious, as you mentioned, as physical health, because if you've got a broken leg, you can see that. But if there's been some sort of problem or crisis in your life, you don't necessarily show that. You might put on a brave face or something like, or you think you've got to have that old sort of British thing of a stiff upper lip, which actually is one of the worst things you can do, but that's another matter. And some people say to you, oh, well, there's not really a problem in the workplace. Well, mental health is like physical health in the sense that if you've got a broken leg it affects your personal life. It affects your working life. They cross over. You don't go into work in the morning and metaphorically hang up any problems or issues or something that you've had from your personal life. If you've had a row with somebody, an argument, that can generate all sorts of anxieties. And you might think, well, that's not a mental health problem, but it affects you. It affects the way you think. It affects the way that you react. So when you go into your work, whether it be in business or in an educational setting, you don't hang your anxiety coat on the coat rack when you go in and forget about it.
You see, I think I'm just going to cut in there, because speaking as somebody that's come from, a teaching background and really suffering with anxiety historically as well, I, at that time, honestly believed that that's what I did. that I came in, I slapped a smile on my face and that nobody noticed. And I think, to be fair, I was quite good at that. But I also know now, looking back on it, that people pick up on things much more easily than you think they do. And even if it's just, you know, they feel like they need to tiptoe around you a little bit, or you're just a bit cranky, that it does impact them. It generates a feeling, doesn't it? Even if you're just moaning in the staff room, that gets other people moaning. It kind of stirs up bad feeling with a lot of people, or it sort of lowers your productivity. And particularly in teaching, if you're not motivated, or if you're a bit sluggish, that's going to impact the children as well. If you're at work, that's going to impact your colleagues as well. If you're a leader, that impacts everybody. And you might not realize that because you think that you've got a smile on and you've just forgotten about it because you're at work. But it just doesn't work like that. I think you're right. It's not as easy as hanging it up on the peg. And the other thing that you said is about the stigma. And I think actually that is still a massive issue, particularly in certain businesses. I think there's areas where it's becoming much more forward moving and much more talked about. But there's certain areas of business where it's still not talked about particularly. I know places like construction, talking about well-being is quite a big no-no, and I think probably because it's a male-orientated business and a lot of people in that business are self-employed and they worry about losing their jobs and things like that. So I think a lot of mental health actually is still, people still try and keep it covered up.
Yeah, and you're right. And I think I saw some statistic the other day that about 35% of people with any form of mental health issue are reluctant to talk to anybody about it, even a colleague in a non-formal way, just saying I'm not feeling great at the moment, just because of all of those things. And that in itself generates more stress within that individual. And as you say, it sort of cascades out, because when we're stressed or when we're tired or something like that, our ability to think diminishes. We're much more likely to make mistakes, and we're much more likely not to interact with our colleagues in a positive way. We're probably likely just to snap back at something, which then generates a feeling from that colleague to say, oh, you know, I'll stand back from that. I won't talk to that person. And that can cascade on and cause all sorts of difficulties.
Or even just being quite insular as well. You know, if you decide that you just don't want to talk to anybody, and if you sort of shut down a bit, nobody will notice. That I think has an impact, because people will not really want to talk to you or get involved with you then either. And that I think can exacerbate the problem in yourself, cause unhelpful thoughts and feelings amongst other people then as well, if they feel that you're not approachable, because you're not creating those same good ideas. You're not motivating each other. You're not working well as a team if you're shutting yourself down a bit.
Yeah, it's true. All of these things, and it just has that ripple effect, cascade effect on all the people around us. And 99% of people wouldn't categorize those things as sort of mental health issues. They would just think that they're an arrogant person, they're a moody, they're whatever it is. But there's more than likely some sort of reason about it. And what we're talking about in terms of helping with mental health and working with teams or leaders, whether it be in business or in education, it's helping people to understand and recognize those things, to help individuals. And therefore, when you help the individuals, you help the group, and therefore you help the business or the education establishment. One thing you mentioned earlier, Abby, about people worried about losing their job or something like that. This can create something called, I find this word hard to say, presenteeism, always at work. And something else you mentioned earlier on is how this has a physical effect on your body, and much more than anybody appreciates. There's some research that shows that working longer hours, being present all the time, increases your mortality rate by about 20%. I've got to admit, I have no idea how they sort of work that one out, but that's quite a staggering figure.
Yeah, it's a big number, isn't it?
It is.
I think one thing that strikes me as well, that it's mental well-being in the workplace isn't just about going in and helping those individual people that need it. It's not about just going in and offering a counselling service, because let's face it, how many schools and businesses offer some kind of support for their staff, where there's a phone number that they can contact somebody. Who phones it? You know, is it a used thing? Do you monitor how many people a month phone it? Do you monitor the success of that? Do you know the impact of that? Does it work? And the reality is, I think a lot of times is people don't want to pick up the phone. They don't want to do that. And it's not about just sorting those people out, if you like, one at a time. I actually think that if you have got an environment and a workplace that promotes a healthy well-being, a healthy mental well-being for everybody, you can actually help people without having to tackle them individually. So I think if you've got leaders that make their staff feel cared about, make them feel listened to and valued, if you've got an environment that promotes well-being, you know, flexible working hours or direct sunlight into the room, or, you know, there's so many different things that you can do to improve well-being in a workplace, that actually if you've got a workplace where people want to be and they love being a part of, actually you can improve well-being hugely just by doing that. And there's always going to be individuals then that still perhaps need extra support, and that might be things going on at home. But if you make the workplace somewhere that they want to be, and you have emotionally intelligent leaders that are really good listeners, that really care about their staff, that know how to make them feel important, because actually if your staff feel cared about, they work harder. If they work harder, you get better productivity, you get more motivated staff, and that essentially leads to a better business or better results or better school results, happier children, you know, whatever it is. Those basic things that actually seemingly look like nothing to do with mental health, I think, can have a huge impact on the well-being of your team, and further and wider as well.
Talked earlier about presenteeism. Actually, the opposite of that is absenteeism. And mental health has an enormous effect on absenteeism. I think you quoted the statistic at the start. More people who are on sick leave, it's over 50% to do with mental health issues.
Yeah.
And of course, then this puts pressure on the staff that are there, that are left, because it can increase their workload, or you're bringing in temporary or supply staff who need a bit of time usually to get up to speed.
Yeah, and something like 78% of people say that their workplace, whether that's school or business, do not provide staff with works to promote well-being.
Right.
That's a massive number. You know, nearly 80% of people say that their workplace does not promote staff well-being. And in schools in particular, 91% of teachers say that their school negatively impacts their well-being. And I think that's, you know, that's scary. And if staff feel like that, how do the pupils feel? If employees feel like that in a business, what's the impact on their clients? You know, if you've got staff that are not happy, or they're not feeling like they want to work for you, or how's that impacting their sales or their relationships with clients? The impact is massive. It
is. And I think what we do is not, as we said earlier, not wait until there's a crisis or there's a problem. We do, I suppose what we offer is prehab rather than rehab, which can help to cut down, and the stats show that as well, help to cut down all of the problems we talked about, presenteeism, absenteeism, and boost productivity to a business and in schools, etc., and just general well-being. And of course, that has an effect not only in the business environment or the educational environment, it has an effect in that individual's life right across the board, and which then, to sound a bit grand about this, has an effect across society. Yeah,
well, well-being is everyone's business. Yeah. You know, it's not just about training your leaders or your CEOs or your head teachers, because actually, in whatever setting you're in, it's everybody's business. Yes, from the top, and it does cascade down, but you need everybody to know how to look after their well-being as well, or you need everybody to look out for each other's well-being, whether that be, you know, your kitchen staff, your maintenance people, your dinner ladies, your teaching assistants. It needs to be down to everybody, because I think if everybody is on the same page, then you can all support each other and look out for each other and promote well-being in each other as well. So yeah, it's not just down to individuals, and it's not just down to management, although I do think that if the management are getting it right, then they're the role models, aren't they?
Yeah.
The management leaders are the role models. So I think if they're doing things right, then people will follow that much more easily. It's also no good training your middle management and not bothering with your top management. So I think it's everybody's business. Mental well-being is everybody's business. And I think if you have that approach and you create the ethos and environment that promotes that, then you're going a long way to improving lots of those things that you've just talked about there, the motivation, the productivity, your sales, your results, your relationships, not just with each other as colleagues and staff, but with clients, with people at home. I've had so many people that have come to me for business training and they've said, I can't believe the massive impact that this has had on my whole life. Like, I've stopped falling out with my husband. I'm getting on better with my children. And these symptoms of stomach aches that I had that I didn't even think were anything to do with mental health have just disappeared. And that's quite a common thing that we hear, isn't it, Andrew?
Yes, yeah. And talking about the stomach things, I mean, and you mentioned IBS earlier on. IBS is usually sort of like an umbrella term for any problems with the stomach. And about 90% of those problems have no known physical cause. And they're sort of psychological in some way.
Well, they're stress related, aren't they? And the reason that I talk about it as much as I do like talking about IBS, is because I was that person. Yeah. I was that person that I had almost a constant stomach ache. I just thought I was broken. Nobody ever pointed out to me that it might have been stress related. I had surgery, I had investigations, I had test after test, and they couldn't find anything, and therefore they put it in that IBS category, which is what happens, like you say, about 90% of the time. I managed my stress and my IBS disappeared. I haven't had any stomach aches like that for 8 years, a long time. And again, I find that a lot of people that I work with, and I'm sure you're the same, find the same. And actually, it's almost a secondary thing. They quite often don't even notice that the stomach aches have gone away because they never realised that they were linked to stress. But stress on its own is just a massive problem, isn't it? It's in teaching and in business. And we kind of live in this high level of stress. And actually, some people think that it's a positive thing as well. But the physical impacts around stress are massive. Stress is supposed to be a in the moment response to something that it's fight or flight. It's a vital skill. It's a vital thing that we have to save your life. And actually, we don't need to employ that fight or flight over getting a document in on time, over a client meeting, over parents' evening. We don't need to create that same response, because what it does is it floods our body with hormones, adrenaline and cortisol, and they're not supposed to be in your system for a long time. And when they are, the health implications of that are huge, whether that be increased chances of heart attacks, strokes, heart disease, cancer, infertility, migraines, teeth grinding, headaches. Like the list is enormous, isn't it, of the physical implications of long-term stress.
A lot of people don't actually realize or associate things like stress and anxiety with mental health. Mm-hmm. They think it's just, well, that's part of life. And to a certain extent, it is, because like you said, it is certain reactions to certain situations. But when we maintain it, and we do often maintain it, that it causes physical problems. Because if you think of a rev counter in a car, and when we're in a perpetual stressful situation or stressful state of mind, or an anxiety state of mind, that rev counter is always in the red. And if you again relate it to a car, if your car's always in the red in the rev counter, the engine will blow up. And
other people will notice as well. Even if you crank the radio up to full blast, they're still going to notice that your rev is on high count. And I think that's what we forget sometimes, is just trying to cover it up with something else, or slap a smile on or put that mask on. It doesn't mean that other people are not picking it up, or that it's not impacting other people. And that's what I said earlier about the 54% of sick leave being down to mental health. That's why I said I think it should be higher, because I think a lot of other issues are probably mental health related, but they're just not put within that category, are they?
No, that's right. Just imagine for a moment you're a salesperson and you've got poor self-esteem. It doesn't matter how you try to mask that. If you're going to a potential client, that's lack of self-esteem comes out, you're much more less likely to get a sale from that, or
Yeah.
develop a long-term relationship, which you may get a sale from, which then will increase your sense of lack of worth, therefore lower your self-esteem, and it has a sort of spiraling down effect, which then has spread out across all areas of your mental. Or if you're in a classroom and you're a teacher and you're trying to boost children's confidence and you're trying to do all of those types of things, and you've got poor self-esteem yourself, children pick up on that thing really quickly. Now, we've talked about the issues and problems, well, some of the issues and problems. The good news is that nearly all of these things can be tackled, can be helped, reversed, and so on. And it's, first of all, by a business or an educational establishment becoming aware that, I mean, really aware, not just a sort of tick box aware, that that these things affect wherever you are, and putting the right things in place, the right measures, the right programs, etc. Again, not just a tick box exercise to say, oh yeah, we've got a mental well-being strategy, or we've got an employee.
The phone number. The phone number for people to phone that are struggling.
The phone number, or here's a website. But really understand, put that in place, then lots of these issues will go away. And not only go away, but in terms of business, the productivity is boosted. The Ross School of Business, an American school of business, did some research, and they said that by and large, businesses that have taken care of people's mental well-being can increase productivity by 20 or 30%. Now, that's enormous. Plus, the retention rate of staff is great. You get fewer people leaving. So therefore, you don't have, the business doesn't have the problems of retraining, the costs of all of that. And it takes about 4 to 6 months for a new person really to bed in and be up to speed. So you've got all of those costs involved. And you can do something about all of that.
And it's not just going on a training course and being like, oh, that was really interesting, and then forgetting all about it either. Like, we've done that, we can tick the box, like you say. And it's about measuring the things that you have in place as well and making sure that they work. So, you know, having that access to online counselling and stuff, that's all well and good. But is it working? That's what you need to know. Are people accessing that? Rather than just saying, oh, yeah, we tackle wellbeing by having A, B, and C. How do you know? How do you know that it's actually impacting the wellbeing? Do you measure that? Do you do wellbeing audits? Do you have somebody in to do wellbeing audits for you? Does your health and safety policy cover mental health as well as just all the physical things? Because I think most health and safety policies look at the physical aspects, and actually it's meant to cover both, and it's meant to cover both equally. So yeah, you might think you have things in place, but do they work? How do you know they work? One thing that we hear quite a lot as well is, oh yeah, we have our own in-house training for that. But again, what is the impact of that? Do you measure it? Or is it just saying, oh yeah, well, we've covered, we had a staff training session on wellbeing or stress. Well, how do you know that that worked? Were the people delivering that trained? Do they know what they're talking about? Do they know how to work with people and get those messages across? Have they put the things in place that need to be put in place? Have you got long-term support to improve the ethos of your business, to talk about what you can put in place to make that workspace a place that people want to be? It's all of those things, isn't it? It's not just about going to a half-day course and saying, yeah, we've done wellbeing.
Implemented, but not the whole thing. And
well, life's busy. Life is busy. And to implement that, I think it's really important to have the support to make sure that those things are being implemented, to almost be accountable for those things and to measure the impact. Because I think when you see the impact of doing these things properly, it makes you motivated to do them more then, doesn't it?
Yes. And that again is something that's really important, because on the face of it, a lot of these things might seem intangible, but they're not. They can be measured. even the very basic, how many sick days do people take over the course of a year? Has that diminished?
Mm-hmm.
And if we were to go into work with a company now and come back in a year's time and ask that question, 99.9% of the time, the answer to that would be yes. And not only yes, significantly yes.
Yeah, and that's why we start with the wellbeing audit, isn't it? Whatever setting we're going into, we start with an audit. We need to see what you've got in place, whether, you know, do you know what your stats are? Do you know what the impact of mental health is on those stats? We kind of really break it down, see what's working well, what you've got, whether you know it's working, how you measure these things, and then we've got somewhere to move forward from that and help and support you, so that you can really get this stuff going, so that you can really implement it and have it as part of your business, not just a one-off thing that you drop in as and when you need it, just so that it's there as a constant and it just becomes part of what you do. Like I said earlier, well-being is everyone's business, and to do that, it has to be part of your everyday and everything that you do within that role.
That's right, and that's why it is important that the top leadership teams, the CEOs and the like, are all on board with this, but not just on board with it, actually living it as well, because that is they set the ethos for a business or for a school, whatever it might be, and that then trickles down and it goes all the way to every member of the workforce. It is also important that people feel part of it. They feel included. And it's not just like the health and safety rep. It's not just so we've got a mental well-being rep or whatever you want to call that person. It's not one person's responsibility. If things are implemented well, it's not, you can take the word responsibility out, because that implies something about it's a way of life within the community of the business or the school. That in itself increases the well-being of the whole community.
And that's what we started off by saying, really, isn't it? It's not just about targeting individual people that need support, although that might be part of it as well. It's about having that overall attitude, that overall ethos and feeling and environment that people want to be a part of, that they're proud to be a part of, and that they want to work in. Because if you've got people that want to work there, that like being there, that will make a difference to everything.
What should people looking at this now, say you're a CEO or a head of HR or just a person in a business now, and they're looking at this podcast and they've managed to get this far in the podcast, well done. And well, what is it? How can we do the things that you've talked about? Well, Abby, you've mentioned about an audit, and I think the first thing is to get in touch, and we can arrange to come and do an audit with you, look at things step by step, give you recommendations of what we feel that you can do to help your business, not only in terms of your staff, but also grow.
I mean, you might know already what the issues are that you want to tackle. You might be saying, actually, we need you in because we've got a high staff turnover, we've got high levels of burnout. You might already know what the issues are. You might also not know what the issues are, and that's fine too. It might just be that, actually, I know that we can improve, or this is what we want to focus on over the next year or two. This needs to be a priority for us, but we don't know where to start. And that, again, is where we can help. So that's where I say the wellbeing audit. It's not the wellbeing audit. It's talking to us. We know what we do. That might sound a bit bold of me, but we do. We understand mental wellbeing. We're well trained in it. We're experienced in it. We can figure out what you're doing well and what you can be doing that would make a huge difference in your setting, to the managers, the leaders, the heads, the teachers, the clients. You know, we know the things that you can put in place that will make that difference. So the starting point is to just get in touch.
I think on that note, we'll finish now for today, and we look forward to seeing you all soon.